MicroSave's government and social impact domain works with various governments to help enhance financial inclusion endeavors. Globally, social welfare spending by governments is as high as 30% of GDP for many countries. This spending is towards food, education, health, family welfare, women and child development, social justice and empowerment, rural development, and basic minimum services depending upon the country's socioeconomic profile. Despite this expenditure, there are last-mile delivery challenges that plague social welfare programs. According to a research by the Economic and Political Weekly, leakages can be as high as 50 to 60%. Benefits are often delayed and beneficiaries excluded due to poor identification and targeting. In order to bridge this gap, a growing number of governments are turning to MicroSave's GSI team for advice and technical assistance, particularly on the design and delivery of direct cash transfer programs. With the advent of new technologies, governments have begun transition to a system where products are sold to beneficiaries at market rates after identification, with the subsidy being transferred directly into the beneficiary bank accounts. For 20 years, our teams have been visiting underprivileged households in rural and remote locations, understanding their challenges, needs, aspirations, perceptions, and behavior to strengthen last-mile delivery systems. GSI prides itself on providing clients with a bottom-up understanding of ground realities, policy recommendations based on data-driven insights, implementing and assessing pilots of innovative ideas, and delivering within rapid turnaround times. GSI has been consulted at the highest levels of governance, particularly on the entire cash transfer ecosystem. Apart from government agencies, the domain also consults with donors, development organizations, academic institutions, think tanks, and NGOs. With core expertise in India, MicroSave has been instrumental in refining and assessing critical Aadhaar-driven reforms in fuel, fertilizer, and food subsidies, particularly PEHL, direct benefit transfer for fuel subsidy, direct benefit transfer of kerosene, Pradhan Mantri Ujjwala Yojna, creating access to clean cooking fuel for families below poverty line, and biometrically authenticated physical uptake of food and fertilizers. Over time, GSI has expanded to India, Indonesia, Malawi, Nepal, and Bangladesh. India has emerged as a center of best practices in reforming subsidy delivery. Various governments are keen to learn from India's social transfer experiments and are seeking out GSI's expertise in digital public assistance programs. Delegation from governments of Indonesia and Bangladesh recently visited India. MicroSave GSI facilitated a holistic understanding of policy, execution and impact through workshops, interaction with ministries executing DBT initiatives, payment expert and beneficiaries. Today, GSI has expanded in scope and currently provides strategic consulting services, policy advice, pilot design and evaluation, and sustained implementation support to public and private sector stakeholders on administrative and governance reform, digital governance, and social welfare. Role of digital ID is critical in government subsidy reforms, and MicroSave is building evidence and knowledge pool to understand the impact of digital ID on enhanced administrative efficiency and subsidy delivery process. What do you say after watching the video? Food grain or cash? Kerosene or LPG? Subsidy or universal basic income? Feel free to write to us at info@microsave.net.